Hello, my name's Gareth Morgan. I'm going to talk to you today about the risks of multiple myeloma in African Americans. Multiple myeloma is a devastating disease that's associated with pain in the bones, fracture of the bones, anemia, and progressive debility until death. And before we had good treatment, the average survival really was only 10 months. And with good treatment these days, we're able to get people to live for a significant amount of time, out to, as long as 10 years and beyond. But for most people, the disease is much worse than that. And in an attempt to understand the disease, we built a number of disease models based on the transition from a precursor phase of disease, which is benign and has no real impact on the patient, to a more aggressive disease, which is moving forward, then to multiple myeloma itself that damages the bone. And then when it no longer lives in the bones and can swim around in the blood, it's referred to as plasma cell leukemia. Myeloma is a disease of the elderly, and in a variety of epidemiologic studies, including the SEER dataset, it's possible to see that as people get older, they have increasing risks of developing multiple myeloma. But a striking observation has been that in African Americans, there is a 2 to 3-fold increased risk of having multiple myeloma than in white Americans. And this is quite perplexing. It is an important observation that stands up to the scrutiny of multiple studies. And yet, even after knowing about this for many decades now, we don't fully understand why this difference occurs. And this difference puts a huge burden of disease on the African American population, especially as they age. So an important question is, does this excess risk translate into a worse clinical outcome? And I think in terms of treatment, the data has been very variable. So in some studies, it looks as if African Americans do better than Caucasian Americans. However, in other studies, African Americans have done particularly badly. And so really, I think at this stage, this is an area that needs more studies. But I think the socioeconomic consequences of being born into a Black community impair your likelihood of optimum treatment. And so potentially, not only is there an increased risk, but there is an increase in the negative outcomes associated with treatment. It's generally agreed from a number of important commentators that these are important factors in the disparities that beset the African American community. And as such, fully understanding how they arise and how we can deal with them is a very important and current question that society has to address. And we can think of the causes as being a number. So why is there an excess risk in African Americans? Well, we can think of immune causes, so variations in the immune system, because this is very much a tumor of the immune system. Is it lifestyle? Is there something about exposures and socioeconomic status that contribute to increase this risk? Or are they all genetic? Is this something about inheritance within the African American community? Or alternatively, is it bias and racism? And I intend to discuss these different points in more detail. And so chronic infection and immune stimulation have been known to impact on the immune system for a long, long time. And the idea is that chronic immune stimulation stimulates the production of these abnormal precursor cells that lead to multiple myeloma, and so therefore increase the risk. yet. A number of studies have been carried out looking for associations. They've looked at allergy, musculoskeletal disorders, rheumatoid arthritis, chronic infections. But while people have looked, an answer has not really been forthcoming. And it has to be said that even after a decade of research, that no convincing evidence exists of an association between chronic immune stimulation and an excess risk of multiple myeloma in the African American community. A factor that is important and is known to be important is obesity. It's a common lifestyle-related factor in the US that is active in both European and African Americans. It is, I think, now pretty much unequivocal that people who are obese have an excess risk of a number of cancers, including multiple myeloma. But still, the outstanding question is, are these differences in obesity between the African American and European American community sufficient to explain the difference in risk? And this remains an open area that is still the subject of increasing research. Further, socioeconomic status is known to impact the risk of multiple myeloma. And a number of studies have shown that not only is there kind of disparity in terms of socioeconomic status between the African American and European American population, but patients who are socioeconomically deprived have impaired outcomes. And so, again, this is an important area where we can make big differences, improving outcomes for the cases that develop multiple myeloma. The way to determine whether there's a genetic component to risk of multiple myeloma in African Americans is, of course, to go back to Africa and look to see whether there's an excess risk among Africans. And when people have tried to do this, the Gambia was a good country in which to ask this question. And largely a population-based study there collected cases and found that the risks in Africans were the same as they were in African Americans, with a 2 to 3-fold excess. You can use self-reported race as a way of determining whether there are genetic differences between African American and European Americans. And it looks in an initial small study that there were an excess risk of specific genetic subtypes in the African American populations, which are associated with relatively good prognosis, which would map with the clinical studies. The rather better way of addressing the impact of genetics and the combination of African and European genes is to rely on information from the African diaspora. After they were brought to America, they were initially in the South, but since that time, the diaspora have become more diverse and have moved progressively in a number of ways across the US. And what we know from studying the genetics of these populations is that African Americans are unique. They're composed of both African and European genes, and in the South, the combination can be approximately 80% African, 20% European and Native American, whereas in the greater the distance you move from the South, the more likelihood there are of European genes, and you can have as many as 30 to 40% European genes. And this really does have a potential impact on the risk for individual patients. A study that looked at this found that you can dissect out risks much better by using this genetic information than you can by using self-reported race, and this will allow us to be able to identify significant features much more readily than simply relying on a person's perception of their race. But in two other studies, in particular one that used sequencing, although they found differences, it has to be said that these differences were minor and were not repeated in a second study which aimed to recapitulate these findings. So at this point in time, while there are appealing suggestions that the genetics and outcome may be different, I think we have to start from the point of equipoise, where we don't know whether there are or aren't genetic differences between the different populations. There are other ways that you can define risk, and one of these ways is called genome-wide association studies. These are called GWAS, and the aim is you look at inherited variations or variants that differ between large populations. So the majority of these studies have been done in European populations and found a number up to 25 inherited features that affected your chances of developing multiple myeloma. And with a group in California, a recapitulation of these studies in a large group of African Americans was carried out. And this was a successful study in that it was able to show that the features increasing the risk of multiple myeloma are common between African American and European Americans. No specific locus was found that was specific to the African American population. And so where are we then? We've managed to show very few differences. So what are we going to use as a way forward to understand the genetic differences? Well, a new development came along recently, which were called mutational signatures. And in cancer, there are a number of different mutational signatures. And in myeloma, there are only a limited number of these signatures. And so it's been possible to look between African Americans and European Americans on the signatures which characterize their cancer. And so we've learned several things from this study. One is that myeloma probably starts 20 to 30 years before it develops clinically, which can improve epidemiology studies which aim to see environmental factors which increase risk. So an important feature of the information we've learned from applying immune signatures to studying the patterns in European and Africans or African Americans is that there are 4 different trajectories based on 2 immune signatures, one called non-canonical aid and the other called APOBEC. These are indicators of the strength of the immune response in an organ called the germinal center. And importantly, we find differences between Europeans and African Americans. And one potential explanation for this could be that in Africa, when humans evolved originally, a strong immune response was essential to be able to survive until adulthood, to pass on your genes. This strong immune response, when moved to the Americas in a world that is now largely sterile, could no longer be as pro-survival as it was originally. And under those circumstances, the enhanced immune response can lead to enhanced off-target effects, enhanced immune signatures, and an increased risk of multiple myeloma as a consequence. This is an important fact because if we can understand this, there are ways now where we can condition the immune system to reduce that overactivity so that any excess risk of multiple myeloma could be reduced. And I think this is a very exciting potential for the future. So I'd like to thank you for your attention and to suggest that these are very exciting times. We're really starting to understand the genetic features that increase the risks of multiple myeloma within the African community, and how interactions with the environment are increasing these risks. With this comes optimism that we'll be able to intervene and reduce the risks. Thank you for your attention.